All right, the top of the hour. So we're going to go ahead and get started. Let me know in the chat if you guys can hear me, if everything sounds good, as well as we're going to be talking all about Medicare today. I know it's a complex topic, the Medicare world, anything put out, any government program put out, I feel like it's always complicated. And so if you guys have any specific questions, go ahead and ask them in the chat. I don't know if I'm going to be able to answer them all on this call today, but we can make sure we answer them afterwards for sure. And so let's go ahead and get started talking about Medicare. So in this training, we're going to be covering a couple different things. We're going to give an overview of the Medicare system, what Medicare will cost, what it will all cover. We're going to go through 5 Medicare mistakes that can lead to permanent increases in healthcare expenses. So you're definitely going to want to make sure you avoid those 5 mistakes. And then how you can choose the right Medicare options to fit your needs and how to budget for those healthcare costs so there's no surprises down the road. Medicare is, like I said, Medicare is complicated. It's funny because we look at Social Security, we look at Medicare, 2 programs that we paid into for so long. And when we're ready to get advice on those, Tony's saying there's no slides. 1 second here, guys. Tony, can you see the slides now or no? I know we're in a little bit of a lag, so if I ask a question to Tony, it's going to take me about 20 seconds to hear back from him. So just 1 second, everyone. All right, I'm going to continue going. Tony, let me know if there's a lag here, okay? So anyway, like I was saying, pay into these systems, these government systems with Social Security and Medicare for so long. And then right when we're ready to use that system, we're ready to file for our Social Security benefits or try to figure out the best Medicare option, we really have no help. And so this presentation today is going to act like a little bit of an overview, kind of give you guys some background information so you can make the right Medicare decisions. Okay, so first off, there's kind of 3 different healthcare phases that you're going to go through when you're in retirement. So if you retire before 65, you're going to have to find your insurance needs in the Obamacare marketplace, or if there's COBRA insurance continuance from work, that might be an option. And this can get expensive depending on how much income you have, especially when talking about Obamacare, or if you're able to keep your income low enough, you can save pretty big with some government subsidies. From the majority of the time that you're going to spend in retirement, you're going to be on Medicare. So that begins when you're 65 and lasts through your retirement. And this is a little bit more of a healthcare preference, cost preference period. And we're going to talk about that in today's presentation. And then towards the end of your life, 50% of people need some kind of long-term care need, and that can obviously get quite expensive depending on if you're needing an in-house help or if you need to go into some kind of nursing home or something. So we're going to focus on that middle stage mostly in this presentation. Some common terms that I want to make sure everybody understands from the start that we're going to kind of throw around throughout this presentation. First off, premium. Now, a lot of you are probably familiar with these terms through your insurance through your work, but the premium is basically what you pay each and every month to just have the healthcare insurance. Okay. From there, on top of that premium, a deductible is basically the out-of-pocket amount that you owe before benefits start. And then from there, there's cost sharing. Okay, so co-insurance is one of those cost sharing. So let's say your deductible is $1,000. You've met your deductible for the year. Well, then the way Medicare works is there is ongoing cost sharing. And so co-insurance would be after that $1,000 deductible, you might owe a percentage of the costs above that. A copay, obviously, most of us are familiar with, is a fixed dollar amount that you might owe going into a doctor's visit or getting a prescription filled. So again, just want to make sure everybody from the start knows these terms because we're going to be using them as we go through the presentation. So a big misnomer that I see many retirees make is thinking that Medicare is free. And you've been paying in your 1.5% into Medicare. Your employer's been matching that. And so many of us think, okay, well, Medicare should be free then, right? We've paid into the system the whole time. This is not the case. The only part of Medicare that's free is going to be Part A, which we're going to talk about in a sec. But on top of that, you have two types of expenses you'll pay on an ongoing basis. Okay, you have premiums. Okay, so Part B premiums, Part C or Medigap Policy premiums, and Part D premiums. But then you'll also owe cost sharing. And so like I was saying, once your deductible's met, you might still owe a percentage of ongoing future expenses after that. We'll talk about in each of these different parts what that looks like, how much you might owe. And then the other thing that's important to note is that portions of your costs will come based on your income. And so there's this line in the code called IRMA that basically if you make too much, if you have too much taxable income, your Part B and Part C premiums will go up. And so it's important to note that this IRMA look back is 2 years. And so if we're looking at your Medicare costs in 2020, they're going to look at your tax returns from 2018. And so there's basically 4 parts of Medicare. Part C is sometimes replaced with a Medigap policy. And so again, we're going to go through each of these parts, however. That first part is going to be your hospital insurance. And so this is basically the quote unquote free part of Medicare. If you end up being in a hospital for any extended period of time, this essentially covers your room and board. And so like I said, this is the free part of Medicare because this is what that 1.45% of payroll tax has been paying for. And so it's free for you if you qualify for Social Security benefits or your spouse does. So most of the people watching this will have this, the premium, if you will, free for this Part A part of Medicare. If you don't have a Social Security benefit, it's probably going to be $458 a month as a premium. And then on top of that, there's cost sharing. And so the deductible is $1,408 per benefit period. So what is a benefit period? Basically, let's say today you went into the hospital. Okay, you stayed for 10 days. Let's say you incurred a hospital bill of $10,000. Well, the amount you would owe, the first $1,408, you would be footing the full bill for. Okay, the extra $10,000, there would be Part A would pick up part of it, and then there'd be varying coinsurance on the back end. But let's say after those 10 days, you went another 60 days, and then you entered back into the hospital. Well, that benefit period ends after 60 days of not needing any hospital care. And so you could have multiple benefit periods in 1 year. So you could incur that $1,400 deductible multiple times in 1 year. And the coinsurance on the back end can get a little bit complicated. There's a few levels to coinsurance. We could talk about it for an entire Wealth Wednesday, but this is kind of just an overview for now. Part B is going to be your outpatient care. Okay, so if you go to a doctor, you've got a cough or something like that, this is when Part B is going to kick in. You will owe monthly premiums based on income. Okay, so the beginning premium amount is $144.60. It can go up from there. And so again, this is the Medicare, this is the part of Medicare that isn't free. Okay, you owe premiums each and every month. It's also important to know, and we'll talk about what it is, how much it is. There are late enrollment penalties with Part B and Part D, meaning that everybody's got a set enrollment period. And if you miss that enrollment period, you will have a permanent step up for the rest of your life in premiums. Okay, so you'll essentially have an ongoing penalty each and every year. The cost sharing part of Part B, you have a $198 deductible per year, which isn't much. But then after that deductible is met, you have coinsurance, 20% of ongoing costs. So again, if you incur $10,000 of outpatient care in a given year, after that $198 deductible, you're going to owe 20% of that ongoing cost. So that can get pretty expensive depending on what kind of healthcare needs you have that year. And again, for Part B and Part D, we're going to have this little line in here, beware of the penalties, both on the penalties of making too much and having your premium step up, but also on late enrollment penalties. We're going to skip Part C and come back to it and go on to Part D. This covers your prescription drugs. It's important to note it's optional. However, we'll talk about why it might not make sense to be optional. Premiums range widely from $10 a month all the way up to $100+ a month. And because premiums vary widely. So does the coverage and cost sharing as well. The maximum deductible that any company can charge for Part D is $435 for the year. That shouldn't be for the month. But again, beware of penalties because there are IRMA step-ups for Part D as well as late enrollment penalties. And then the final part that you might use, might not, is Part C, which would be Medicare Advantage. Most people on this call, I'm guessing, will end up getting a Medigap policy, which will replace that Part C. And so these policies have additional premiums costs, but essentially fill the gap. And so we talked before about how in Part B, if you have ongoing insurance or if you have passed that deductible, you have to pay 20% of those co-insurance costs. Well, basically what a Medigap policy will do will fill in those cracks. So depending on what type of Medigap policy you get, it eliminates a lot of those cost sharing needs on the back end. And so as with most insurance policies, a lower premium will mean more cost sharing, more gaps that could potentially open up. Higher premiums can cover a lot of those back end costs. So we're going to talk about how to decide which one makes the most sense for you. So before going into the 5 mistakes, I want to touch on enrollment periods. And there are a few different enrollment periods to know of. The 3 that we're going to talk about today are your initial enrollment, your special enrollment, and your general enrollment. And so again, with these complicated government systems, we'd expect that there would be some kind of support to kind of walk us through it. They created this complicated system and then they just kind of just hand it off to us and expect us all to know what to do. Well, like Social Security, don't expect anyone to handhold you through this Medicare process, at least anyone from the government. Okay. But so basically the burden's on you guys to make sure you understand the penalties, the costs, and the right options. And so in that vein, there are 3 enrollment periods that are important to know and could cause your premiums to go up. The first one is going to be the initial enrollment. That's the same for everybody, but it's based on your birthday. A special enrollment, which we'll talk about what those special circumstances are, and then a general enrollment. So your initial enrollment, we know that Medicare can start when you turn 65. Well, your enrollment into Medicare is going to, the initial one is going to happen 3 months before your 65th birthday and then 3 months after. And so it's a 7-month period, counting your birthday month, that you basically get to enroll in. And this is critical if you retire before 65. So let's say you retire at 62. Well, your Medicare initial enrollment period is the one that you're going to want to note. Okay. And it's the enrollment period where if you miss this enrollment period, you have essentially those ongoing penalties that you will be subject to. Now, again, when your coverage starts depends on when you enroll in this period. So again, if you have ongoing medical needs, we need to know about when this coverage starts so you don't have any gaps in coverage. So for instance, in this initial enrollment period, if you enroll 3 months before, anytime 3 months before your birthday, your coverage is going to start on your birthday, essentially your birthday. Okay, if you enroll in the month you turn 65, there's a month lag. Same thing if you enroll 1 month after 65, there's another month lag. So it's 2 months. Oh, sorry, there's an additional month. So 2 months after you sign up. And you can see 3 months after you turn 65, 3 months after you sign up. Okay, so again, this is just important to know if you have continuing ongoing medical needs, so there's no gaps in coverage. The special enrollment is going to apply for somebody, let's say that you work past 65. Okay, so let's say you still have coverage through work. Well, they're not going to make you sign up and pay for Medicare on top of the coverage you're already getting for work. So there's something called creditable coverage that basically allows you to delay your Medicare enrollment with no penalties. This is called Medicare special enrollment. And basically once you retire, once you stop that coverage from your employer, you have 8 months for Part A and Part B, and then 63 days for Part C and D. Okay, so let's say you work till you're 66. Well, your Medicare special enrollment will hit as soon as you retire and your coverage stops. And if you miss this period, again, that's when those penalties on the back end will start. So if you end up missing both periods for whatever reason, you're forced to be subject to the general enrollment period, which can definitely offer some legs and coverage because that general election period is between January 1st and March 31st, so essentially the first quarter. But then coverage doesn't begin until July 1st. And so there can especially be some gaps there that end up showing themselves. So let's move into some costly Medicare mistakes, though. We've covered some overview. Let's see how these mistakes apply and how much they can actually cost you. So, like we just said, talking about enrollment, missing your enrollment is a giant mistake that can affect you for the rest of your life. So it's important to know any mistakes that you make are permanent. Okay, so if you have it's not just a 1-year penalty that you're subject to. It is an ongoing penalty that you'll have to face each and every month. And so we need to make sure we're getting the enrollment right. The penalties for Part B it's a 10% penalty for every 12-month period that you miss. And for Part D, it's a 1-month penalty per month that you miss. And so let's show an example of what this will look like. Story of John. He retired at 65, extremely healthy. He worked out a bunch, ate the right foods, considered himself healthy, hadn't been to the doctor in a few years. So he thought, why would I sign up for Part B? Why would I sign up for Medicare and pay all these additional ongoing costs? Well, the reason being that we'll show in a sec. So he's now 68 and he needs to see a doctor. And so he's thinking, well, I might as well sign up for Medicare now and get some of those doctor costs paid for through Medicare. Well, because he's 3 years late, he has, again, there are 3 12-month periods there. So he's going to have a 30% penalty on his Part B premiums. So he's going to go from paying $144.60 a month to paying $187.98 a month. And so he essentially has a $40 penalty that he'll be paying for the rest of his life. Again, same on Part D premiums. Okay, it's 1% per month. There's 36 months in 3 years. And so he's going to go from paying $35 a month for Part D to paying $47.60. Now, again, it doesn't seem like much, but it's a penalty you're going to be paying each and every month for the rest of your life. And so what does this add up to? If we look at 30 years that he's retired, this one decision, this one penalty is going to cost him almost $30,000. Okay, so make sure you're not missing your enrollment periods. We can definitely help kind of guide you through that if you're not sure which enrollment period applies to you. But number 2 is mistakes around creditable coverage. So basically what creditable coverage is if you have, yes, so Tony asked if there's changes in premiums, does the penalty go up too? Yes, so that 30% penalty is on that initial premium amount. So let's say we fast forward 20 years and that premium went from $144.60 to $200. Well, it's 30% penalty on $200 then. And so your premiums are going to go up. That 30% penalty is going to stay at 30% of whatever that initial premium is. Okay. So yeah, great question, Tony. That's important to clear up for sure. So creditable coverage basically is if you have coverage through your work that's sufficient enough, you don't have to enroll in Medicare, or you might not have to enroll in Part D, a specific part of it. And so if you have credible coverage and you're working past 65, the Medicare office is going to send you a letter that looks something like this. And I shouldn't say most, a lot of people end up throwing it away thinking that it's nothing. And it's extremely important to focus on, or extremely important not to throw away, because you need to submit that you have creditable coverage. If you don't, Medicare is going to think, okay, he doesn't have any coverage, he's not signing up, so we're going to apply these penalties going forward. So if you miss this, even if you might still have that coverage, but the Medicare office is going to think you don't. And so make sure that if you're working past 65, that you look in the mail for this type of document. It's going to have a proof of insurance or proof of credible insurance or late enrollment certification, something along those lines that you need to make sure that you note and don't miss. Number 3 is not enrolling in Part D. So this coverage is technically optional. However, we highly recommend that the majority of people go ahead and enroll in Part D. Okay, prescription drugs, especially depending on what's happening later in your life, can get expensive. And you're not exactly buying coverage for right now. You're also buying it for the future. And so you might be 65 and think, I'm not on any prescription drugs. So why would I enroll in Part D? Well, you're enrolling for the future, because remember, if you don't, you'll have a permanent penalty for when you eventually do. Now, the annual election period is basically this period that we hear talked about so often right now, between October 15th and December 7th. And not enrolling in Part D can get expensive depending on what type of coverage you have or what type of health care needs you have. And so, quick story of Valerie. So at 65, Valerie wasn't taking any prescription drugs. She was pretty healthy. She, again, wasn't taking those drugs. So why would I sign up and pay for a premium for something that I'm not using? Well, a few years down the road, she was diagnosed with oral cancer. Okay, she found out in July that she was diagnosed with oral cancer. She found out her drug that she would need to take to treat this oral cancer was going to be $5,600 per year, or per month, sorry. A 30-day supply was going to be $5,600. Well, she's sitting in July. Now, the annual election period is between the 15th and the 7th of December, but the coverage doesn't begin until January. And so she didn't enroll in Part D and then found out she needed to pay for this $5,600 drug every 30 days. And so sitting in July, she was looking at 5 months worth of essentially a $5,000 cost that she would have to foot herself, because the coverage isn't going to begin until January 1st of the next year. Now, when her coverage does begin, she's also going to have that penalty, that ongoing penalty. Now, again, she's still going to be paying far less than the $5,600. But luckily Valerie had savings on the back end that she could float that essentially $25,000 bill, but it can get very steep. Now, she would have been much better off just taking a low cost Part D plan, paying $10, $15 a month and kind of just seeing how her health played out. And so again, coverage for Part D is optional, but we highly recommend that most people give it a second thought and enroll in Part D, because again, you're not paying for your coverage now. You're paying it for the future too. So another big one we see is thinking pre-existing conditions don't matter. So many people think when Obamacare was written into law that it eliminated everybody looking at pre-existing conditions, because that was the big thing it was sold on, is that if you have a pre-existing condition, don't worry, you're still going to be able to get coverage. And this is kind of partially true when talking about Medicare. So the Medigap policy, basically the additional policy that you might buy in order to fill in the gaps in your coverage, there is a pre-existing condition filter that they're allowed to look at. So there is something called a Medigap enrollment period. Okay, so this is a one-time enrollment period where they don't get to look at your pre-existing conditions. And so let's say that you have terminal cancer or something like that. In this Medigap enrollment period, you can still get a Medigap policy. But this is a one-time period and then it's gone. It's a 6-month window starting at your Part B election. And so once that period is done, these insurance companies essentially have the ability to decline you for pre-existing conditions. And so in this enrollment period, you basically have free reign to pick whatever Medigap policy you want with whatever company you want. After that enrollment period is done, they can deny you for various reasons. And so if you're looking for a Medigap policy that fills in all those cracks, so you have dependable insurance coverage, make sure you enroll during that Medigap enrollment period. You're not going to be able to switch out after if you have that pre-existing condition where a company might decline you for. And so, again, you cannot just wait until you need the coverage and then think you're going to get it. Depending on what coverage you need, again, you will be denied on that Medigap policy. So again, just an important thing to note, so you don't end up in any lapses in coverage. And then the last one is RMDs and IRMA. So a big issue that we consistently see are people having big tax deferred balances. So what does that mean? So the majority of people end up saving the most of their retirement savings in something like a 401k, and it makes sense because they get a tax deduction when they contribute, and they also typically get a match from their work. And so while you're working, it seems like it makes a lot of sense to continue to contribute to your 401k. Well, the problem that happens once you enter retirement is that as these 401ks accounts or tax deferred accounts keep growing, at 72, you're going to be forced to take distributions, whether you need those distributions or not. It's called a required minimum distribution. And when that happens, depending on how big your tax deferred accounts are, that distribution can put you in a lot of hurt potentially. So it's not uncommon for us to see RMD distributions in the $50, $70, $100,000 range, especially when you get into the later years of retirement. Well, if you're in the beginning stages of retirement and you're not thinking about this RMD situation right now, it can end up costing you on the back end. So this IRMA bump up in your premium, as you can see below. So the table on the left is for Part B, table on the right is for Part D. And you can see that for a married couple filed jointly, if they make over $174,000 of taxable income for that year, their Part B premiums will go up and their Part D premiums will go up. And so you might enter retirement and think, okay, well, I'm only taking $100,000 of taxable income. Well, once you hit 72, if that RMD spits out an extra $70,000 or $100,000 of income that you don't exactly want to take or need, it can end up pushing your premiums up. And so we need to be planning for this. We need to be thinking about this as we plan to minimize those healthcare costs. So this last section, how do you choose the best option and how do you estimate costs? Okay, we've gone over an overview of each of the parts. We've gone over some mistakes. So how do we budget costs? Well, your plan needs to account for healthcare costs. Okay, it just absolutely needs to. Okay, we're going to show kind of an example monthly health bill here in a sec. And we're going to show in a sec as well what happens if you don't account for costs. But your plan accounts for every other cost, right? It accounts for your mortgage. It accounts for your utility bills. It accounts for your grocery bill. So it has to account for your costs as well. I see so many people. I mean, I would say it's pretty close to the number one fear that I hear amongst retirees is planning for healthcare. How much is healthcare going to cost me? How am I going to pay for it? And so much of this fear happens just basically because there's no clarity. Okay, people don't know how much their healthcare is going to cost, and they don't know, and it's not built into their plan. And so we're going to show in a sec how important it is to build it in your plan. But question for you is, do you want predictable healthcare costs, or do you want the chance to have potential savings? And so what I mean by that is, do you want to purchase a bigger Medigap policy that might cost more on the front end, but will fill in all the gaps and holes on the back end, making sure that you never are faced with a giant $50,000 healthcare bill? Or are you healthy? Do you have a savings set up on the back end that you could afford to have a healthcare bill or cost come up? It's important to know, and it's important to think about as we're factoring these costs in. So an example monthly health bill per person might be your Part B premiums $144.60. Let's say your Part D plan costs $35 a month, and then a Medigap policy costs $125. Well, right there, if we just quick add that up, that's about $300 in total costs. It's about $3,600 for the year. Now, again, this is per person. And so quickly we see that Medicare is definitely not free. Okay, there are costs that are associated, and then on the back end, depending on what Medigap policy you have, there are additional cost sharing, co-insurance that you might have to pay. So when we incorporate this healthcare into a plan, luckily our planning software does a lot of the legwork on the back end for us. Okay, and so you can see on the top here, just a quick table for a couple, kind of estimating annual Medicare costs. And so we see the Part B premiums included. We see the Part D premiums, the Medigap policy. And then it also includes an out-of-pocket cost as well. So again, we know there might be co-insurance costs that we have to pay out of pocket on an ongoing basis. And so that's something we need to include in the plan. Again, it might not happen every year. Okay, so we left off talking about incorporating healthcare into your plan. And before minimum distributions, we see that when we combine these healthcare costs for each person in a couple. All right, perfect. Thanks, Michael. Appreciate it. When we combine these costs for both people in a couple, we can see that when we're in Part D and the Medigap and the out-of-pocket, we can see that it can run anywhere from $3,500 to up to $5,000. And so when we combine these for both people in a couple, we see that we're looking at about almost $10,000 of ongoing Medicare costs. Okay. Well, what's interesting, after required minimum distributions, if you have distributions that push you up, we can quickly see how these Medicare costs get a little bit out of control. And so you see Part B premiums are going to go up. They go from $1,735 up to $3,470 in this example. Okay, Medicare Part D jumps from $523 to $906 a year. Medigap policies won't really adjust to income. Out of pocket won't really adjust as much, but we see that in this example, it goes from this couple having $9,324 that we're budgeting for to needing an extra $4,000 on top of that. And so we can see how these required minimum distributions, if they're not planned for, if we're not doing them early in retirement, how they can really hurt us on the back end. And it's important to know it's not just an annual, or it's not just a one-time thing. You have an RMD coming again next year and the following year. And so this can almost be a permanent step up. So it's extremely important to think about. And when people originally come into our office, I see a lot of this. Okay, so when we're incorporating, I see basically that other retirement planners aren't incorporating healthcare into the plan. And so let's say this example here is somebody that's needing $60,000 of income a year. They want $60,000 net. So taxes on top of that might be $10,000. So they might need to take $70,000 from their retirement assets. Well, that's if we don't include healthcare. So if you're not including healthcare in your plan, something's got to give. So we just saw that it can be around $10,000 a year of costs that we have to budget for. And so if you're not including healthcare in your plan, well, are you going to live off $50,000 then? Because you needed $60,000 before. We know healthcare is going to be around $10,000. So are you going to live off $50,000? Because that's basically, if you're not including healthcare in your plan, that's basically the decision you're facing. So obviously you need to include it in the plan, but I want to show in a second how it changes the plan. Okay, so right now, not including healthcare, this person, everything looks rosy. They have a 99% probability of success, meaning that out of 1,000 scenarios, 990 were successful, which is great. That's outstanding. You're going to pass on almost $1.5 million to their kids or causes they care about, which once again is fantastic. But once we include healthcare, again, once we add that $10,000 into their plan, we can see how things change. And again, I'm not saying this to scare anybody. I'm saying this, you can't enter retirement confident in your plan unless healthcare is included. And so this is something we do on the back end for every client. But when you include healthcare in the plan, we see a drastic difference. Okay. Rather than having a 99% probability of success, they have a 77%. Now, that's not high enough that we would recommend them even retiring on that type of confidence scale. And so healthcare in your plan is extremely important to include. It's not something to fear. Okay. Once we include it in your plan, we can work on ways to minimize, but we need to be including these costs and budgeting for these costs inside of your plan. So making the right Medicare decisions, it really comes down to enrolling at the right time with the right plan. And a couple questions to think about are, what are your health and medical needs? Okay, are you someone who hasn't been to the doctor in 5 years, are healthy as a whistle, or are you someone who seems to constantly be in the doctor for various health reasons? Hey, how much are you comfortable paying out of pocket, and how much do you want to pay on an ongoing basis for a policy that might cover those gaps? Okay, do you have the assets to pay for something out of pocket if it arises? And again, this all feeds into what kind of supplemental policy will you choose to feed in or to fill in those gaps. It's important for your retirement planner and your health insurance agent to work in tandem. Again, Tony and I know enough about Medicare, but we definitely don't know as much as some of the healthcare insurance agents we work with. So your retirement planner and your health insurance agent need to work together, because as we've been talking about, so many of these things feed into each other. Okay, your retirement planner needs to be controlling those RMDs so that we can budget for those healthcare costs. Your health insurance agent needs to be in contact with your retirement planner to know how much to budget in your plan. And so these people should be working in tandem. We've got a few great health insurance agents. So if this is something that you're wanting to get a better picture on, just let us know. Go ahead and comment. Comment Medicare in the comments if you're looking for help on that. Either Tony or I will reach out and private message you. Otherwise, you can either reach out to Tony or I and private message us if you're looking for a little bit more insight on that front. But in summary, healthcare costs don't have to be a point of angst for retirees. There's nothing we can do about it at the end of the day. We are going to owe healthcare costs no matter what. Okay, it's out of our control. What is in our control are minimizing those costs. Okay, making sure we plan properly for those costs. The right decisions, as we've talked about, can help save you big, and the right plan can help eliminate a lot of that healthcare uncertainty. So make sure that your healthcare costs are budgeted into that retirement plan, and also stress test for higher costs. Okay, so for instance, we were budgeting in $1,000 of out-of-pocket costs. Well, what happens if something significant happens, like cancer, and those cost-sharing costs go up? And so every plan that you have built should also be stress tested for healthcare costs rising, and also for a catastrophic issue happening. If you need help navigating the 3 healthcare cost phases, again, go ahead and comment below, comment Medicare, and either Tony or I will reach out to you. But it's important to always understand, we always end the presentation with this, that you don't need more money. You need a better plan. You need a better plan to save on healthcare costs. You need a better plan to be more confident and have some peace of mind that healthcare costs aren't something to worry about. They're something to plan for. Thanks for watching, guys. I apologize with the technical issue. It's a brand new computer. I'm not sure why it was acting up. So thanks a lot, guys. Have a good one.